Hello dear students, we will discuss a procedure for an ulcer which has now become more and more popular, very commonly used and very effective also to allow the ulcer to granulate and make the ulcer bed healthy so that you can go ahead with the skin graft later. That is VAC therapy. So this is the VAC therapy. What this procedure is, VAC therapy. See that negative pressure wound therapy, that is called as. See that here sponge is kept, sellotape is kept, so that is a closed system, no air, nothing will leak. So this through that tube comes here and connected here, negative section draws all infected fluid, everything. So nothing can either keep the wound dry, so allows the granulation tissue formation. That is the idea, advantage. It is a vacuum assisted closure therapy, VAC therapy. Negative pressure wound therapy also called as, but so very useful. Negative pressure up to 25 to 200 meter mercury, it can be used. It can be used continuous or intermittent. Everything comes here, measure. This collects here. So you can connect to this one, this you can hold and go. So usually it is kept for 5 to 7 days. Then you can reopen and see how much it has come. Once more you can put. If it is healthy and granulating well, then you can put a skin graft. Small wound you can go for a second suturing as such. So this is again very useful, currently appreciated method and very popular method also. It promotes ulcer healing by reducing the interstitial edema, increasing cell proliferation, protein matter synthesis, promotes formation of, this is what is important, healthy granulation tissue formation, good bed, so that you can put a graft and cover the wound. Covering the wound is important. So sterile foam is placed all over the ulcer bed with the tube drain placed in it. Foam, here foam is there, this is the foam, black foam. Foam is sealed airtight with the sterile adhesive, it's a sterile adhesive. Intermediate intersection through the tube is done. So VAC therapy is more useful in answer the MCQ, decubitus ulcer, venous ulcer, carcinomatous ulcer, Melanese ulcer. Give the right answer, I will get you back later. Students, so please go through my SRB's clinical methods in surgery, current edition. It gives a video like the examination of the different clinical situations. It gives a detailed examination method including history taking of swelling, ulcer, hernia, inguinal swelling, mass abdomen, breast lump, thyroid, neck swelling, salivary glands, all topics, including briefly trauma, how to approach, orthopedic briefly. Then it also includes the instruments, specimens, images, briefly operative surgery, entire thing clinical method with a lot of photos, illustrations, each condition's photos are there, it's very clear. And analysis, history taking, detail, examination, general examination, history taking, history of present illness and past history, current history, treatment history, drug history, local examination, inspection, palpation, percussion, auscultation, clinical diagnosis, differential diagnosis, and briefly in a table form, all differential diagnosis. But it doesn't contain treatment aspect because clinical surgery book only for clinical surgery, analysis and differential diagnosis. So treatment should be checked in detail, principles of treatment should be checked in the manual, my SRB manual of surgery. So this is basically clinical book with the videos of each examination with all illustrations, principles, different methods, different techniques, science. My SRB manual of surgery current edition gives a CBM syllabus, entirely covers all topics, general surgery, endocrine surgery, thyroid, breast, GI surgery, urology, cardiothoracic, neurosurgery, then other topics, arteries, disease, veins, its principles, methods, clinical methods, treatment, complications, approaches, with the quotations in the each page. It covers entire thing, including treatment principles, brief operative procedure also, not in detail. And it also covers briefly instruments, images, anesthesia, briefly oncological aspect, and daycare surgery, audit, surgical audit, metabolic response to surgery, pain management, everything covers as far as required for the CBM syllabus for UGs, PGs and consultant, coming consultant also, with the illustrations, photos, a few video lectures and a lot of MCQs online for each chapter with the QR code. Lot of MCQs for each topic, so each chapter it is there. Covers everything for UGs, PGs, CBM, MCQs, NEET exam, whatever required thing. Please go through it. Very useful book. My operative surgery, extensive voluminous book, 2-volume book, mainly for postgraduates and learning surgeons. All procedures, including major surgery, GI surgery, general surgery, thyroid, breast and other things, include briefly gynecology surgeries, with step-by-step illustration photos, more than 10,000 photos and illustrations are, and which covers everything for to learner. You can, before surgery, they can go through my book and have a step-by-step for the all surgeries, whatever common surgeries, major surgeries, it is there. You can always go through that in detail. Explanations are there. My small atlas of tissue approximation with the videos shows clearly with the principles how to suture tissues. Dissection and tissue approximation, there are two parts in surgery. Dissection is a principle, essential. After this surgery, you have to approximate tissues, deeper layer, skin, softer tissues, everything, bowel, GI, everything. So this principle of tissue approximation clearly given in this book with the videos of it, including laparoscopic tissue approximation. So you can always purchase that and go through that very useful thing to develop the skin, which is essential for all surgeons. Students, I also request all of you subscribe my website, both in YouTube, Instagram and so on. My DigiNow lectures to the JP Publisher covers around 220 lectures in detail as far as CBME syllabus, from general surgery to specialty, urology, clinical examination, cardiothoracic, neurosurgery, all topic, GI, rectum, anal canal, colon, esophagus, liver, pancreas, breast, thyroid, neck, salivary gland, general surgery, artery, vein, everything in detail, all topics, theoretical aspect, surgical principle, operative surgeries, examination, clinical examination videos also. It covers 220 lectures, covers everything. 1 year purchase you can do. It gives detailed thing about explanations with wherever MCQs are required. You can make use of it and you can learn surgery properly as far as CBM syllabus and academic wise also. It gives lot of information towards the surgical field as such. So students, I hope you have understood this lecture very well, and also you can go through my books, all these books, including DigiNow and lectures. Thank you very much. So I hope you understood the VAC therapy very well. Thank you so much.